It's impossible to understand why the price of health insurance keeps going up without understanding what's happening to healthcare costs.
Healthcare costs have gone up year after year after year.
Costs continue to go up.
The products are costing more and more and more.
Now, cost is what's killing us.
In 2003, the country spent $1.7 trillion on healthcare. That's up 500% since 1980. Inevitably, insurance costs keep rising too.
The premium that we charge for health insurance to our members goes up and up and up and up. And employers look at it and they say, we can't afford this anymore. Individuals, young people, look at this and they say, I can't afford health insurance for my family.
So who is to blame?
I think a lot of it is the insurance companies that are driving up the costs.
Their motive is understandably profit.
It's all profit. You know, the executives are getting bonuses.
I just think it's greed, to tell you the truth.
There is a deep distrust of health insurers among consumers. Why do you think that is?
Health insurers are the bad guys. They're the ones who deny coverage. They're the ones who say that you can't go to this doctor or that they won't pay this.
There are plenty of reasons to be unhappy with insurance companies, beginning with the ever-rising premiums. So what do insurance companies do with all that money? How much goes to actual medical care? Surprisingly, according to the federal government's data, on average, about 87 cents of every dollar pays for medical care. Only about 13 cents goes to insurance industry administration, marketing, salaries, and profits. And that hasn't changed in more than 30 years.
The problem in healthcare is that the costs of the medical care themselves are so high that the insurance company costs are almost a drop in the bucket by comparison.
Healthcare costs and insurance premiums are skyrocketing because today Americans use more medical care than ever before. More tests, PET scans, CAT scans, MRIs, more doctor's visits, more procedures. Americans use 70% more prescription medicine than they did in the early 90s. All of this is expensive.
And it's simple arithmetic. I mean, you take the total cost of care and divide by the total number of people covered.
George Halverson is the CEO of the nonprofit Kaiser Health Plan, the largest healthcare provider in California.
If you start doing ceramic hips instead of plastic hips and you double the cost, premium goes up just a little bit. You have a new drug that covers hemophilia and costs $1 million a year per patient. Average premium goes up just a little bit. Keeps moving up.
I think patients, for the most part, do not really understand the connection between the cost of health care and how much they have to pay.
Even though premiums are rising, people covered by health insurance usually only pay a small copay when they go to a doctor or fill a prescription.
The healthcare system in the United States has been structured in such a way that it's insulated people from the costs of the care they receive for many, many years.
No wonder they call Nexium the healing purple pill.
For example, look at a prescription drug like Nexium for acid reflux. With insurance, it will cost a patient about $20 for a month's supply. The real cost is about $120. Someone spending their own money might consider a drug like Prilosec, which works just as well for most people and costs just $20, sold over the counter.
If you're not spending your own money, if you're spending somebody else's money, you have no reason to economize. You have no reason to ask how much a procedure costs.
John Mackey is the president of Whole Foods Market, the growing natural food supermarket chain based in Austin, Texas. Mackey believes part of the reason everyone's insurance costs are rising is because individual consumers don't have an incentive to control costs.
How many people go to a doctor and ever say, you know, doc, how much is that going to cost? If you ever do that, chances are the doctor will say, I don't know. I don't know. You got insurance, don't you? Don't worry about it. We'll just bill your insurance company. I wish I could operate my food company that way, and we didn't have any prices on anything, and people got to the registers, and we'd say, you know, don't worry about how much your food costs. We'll just bill your credit card. But that, in a sense, is how our health insurance program works in America.
Your signature there. Thank you very much. Have a good day.
So today, Whole Foods employees have a new health insurance plan that the company hopes will make employees better healthcare consumers. It's called consumer-driven healthcare.
Consumer-driven healthcare really puts the choices and the thought process back into the employee's hands. Our employees are going to the doctors and they're asking about what kind of medication they're being put on. Is that the most expensive one? Do I really need to be on that one?
The first thing that we want to get out of this class is to recognize the amount of self-responsibility that's required in order to take full advantage of your benefits.
Whole Foods encourages employees to control costs by making them responsible for more of the cost of their health care. Employees here have a high deductible, $1,000 for medical care and $500 for drugs. But the company contributes to a health reimbursement account, which the employee can use to pay for the deductible. Whatever the employee doesn't spend stays in the account from year to year.
That's the beauty of the system, because it really lets you have a lot of say in how you're going to direct your dollars.
It becomes their money. If they don't spend it, it doesn't get taken away from them at the end of the year. So psychologically, they begin to have ownership of that money. They begin to ask questions.
You're allocated enough to cover your medical deductible.
Exactly.
For the year.
Exactly.
Since employees pay high deductibles, the plan is less expensive for the company, and as a result, more employees here are now covered by health insurance. That's why many other companies are considering high deductible insurance plans. But there are some concerns.
Raising the cost of healthcare to the consumer is sort of a tried and true way of keeping the cost of healthcare down. It's a way that we know works. People will go to the doctor less if they have to pay for it. The question is it just reducing costs, or is it actually making the system work better in the sense that it's reducing the useless cost but not the useful cost?
Plans like the one Whole Foods offers are being studied to see if employees do stop getting necessary medical care. It's too early to know,